Namaste. My topic is a study on generalized and specialized treatment modalities in clinic in present time. Myself, Dr. Jayesh Thakkar, am an Ayurvedic practitioner. The aim is to see how the protocol as a generalized and specialized can be developed. It is seen in clinical practice. The same disease will present differently. It's not always that different diseases present differently. The same disease, for example, osteoarthritis or Sandivat, in two patients of osteoarthritis will show differently. From our basic understandings of Ayurveda, we see the Prakriti and Vikriti differences. So the complaints and its grading should be made. And we also understand from the Samanya and Visesa Siddhanta that the same common treatment protocol cannot fit all. One size does not fit all. The basic protocol is the framework which needs to be further developed for specialized treatment. It's like reading between the lines of Chikitsa Sutras from our Sutrasthana. A study in clinical level is carried to understand these concepts and seeing how it is applied by different practitioners and the possible approaches which can be made. The generalized protocol with the basic similarity needs to be the framework of proceeding further for specialized treatment and understanding. An individual or the rogi will represent with different dosa status, the dhatu status, the mala status, the agni, and the mana. Say, for example, the two sandhivata cases with different mana, one with a high sattva and the other with a low or the high tamaguna, will represent the ruja or the pain symptom differently. At subtle level, if you see the guna and the panchamahabhut, they also helps us in understanding the specialized way. The Roga point of view, the Chikitsa Sutra, is in the text. The specialized is on the basis of the Rogi and the understanding of the Vaidya. The diagnosis and understanding will not be always quantitative. It's also qualitative, some which cannot be calculated but needs to be understood, be it through the Astaveda Pariksa or the different Pariksas. We also know that the history examination and the investigations done at different level of disease shows differently, which all the medical sciences also accept. And at minute level, the same stands true in the same disease in two different cases. The application of treatment seems more like an algorithm. The permutation and combination of selecting a drug on the basis actually brings the right effect in the clinic. Developing a model is very important, and this specialization actually comes with Drishtakarma, the mastery. We have seen different schools practice differently. Some are on the basis of Panchamahabhut, some on the basis of dosa, some on the basis of dhatu level chikitsa, some are again on the basis of guna level chikitsa. From diagnosis also we see that some are using nadi pariksa, some are using tongue diagnosis, and some are with treatment modalities. Some are on Rasasastras, some on Kasta Ausadhis. So different schools are actually specialized from the generalized. Even in present time, we see the different COVID cases are representing differently. The immunity or generalized protocol have been set, but the specialized actually is on the presenting complaints. Like the post-COVID cases, we find some are coming with respiratory disorders, some are coming with digestive issues. So our treatment protocol is from generalized to specialized for getting the best result. Present time, we also realize that the immunity enhancement is not same in different people and the same general protocol will not work always. So, how is the way out? The fragmentation technique for diagnosis, we have to see all the spectrums, we have to develop a flowchart algorithm and the possible intervention place plans for Sama Nirama as we have to go deeper to it. And we have to have our flaggings, the treatment protocols, and referring to our different systems. The SWOT analysis is also important. Our priority basis techniques, like important or urgent medicines to be used, Swarna or Rasosa, these need to be used for a selected time. Some medicines can be used for continued. We can use it in less important conditions or less important presentations. For example, the flowchart method, which we need to develop for every disease, we also need to work on the potency wise medicines. We need to know some dose of high potency, moderate, and low potency. The diagnosis also for skin diseases, these are taken from different doctors. We find a grading, the kapha pitta and the pitta kapha, and how the skin represents and the condition presents. So the inferences of how we will be utilizing this is in the selection of drug, is on the grading, the scaling, and our prescribing, and more importantly, unprescribing. What not to prescribe is also something we need to work on at present. The equalizer theory, something of balancing the guna basis, and all this we need to think. The yoga protocol needs to be developed for certain condition, and same should be for the different kriyas, therapies, the diets. The samprapti vigatan is very important for clinical success and acceptance. This concise study is just a example or something which we need to develop at a higher level. And what we found out that the generalized protocol is more for preventive aspect, and the specific protocol is more for cure and clinical success, and the practitioners par excellence will help more in forming this. I'm thankful. Thank you.